This is our third time now running this conference in Reykjavik on a really important subject. We're looking at ligament injury in the knee and its consequences. And this is a huge issue these days. You could almost describe it as epidemic, particularly when we're talking about ACL injury and the huge financial and personal cost to someone who has an ACL injury. So really successful day yesterday, and then today at the office we get to introduce them to our lives here in Össur in Reykjavik, where we really try to improve people's mobility. So yeah, fantastic overall.
I think for the most part it was a very good broad overview of ACL injuries, which is a large part of my practice. I do pediatric and adult sport medicine, mainly knee surgery, so it was nice to see the preventative stuff, which we've done a little bit of work with ourselves, and also moving on to the operative and post-operative, and even looking at the sort of failed ACL graft as well. So I think it was a very good conference from that point of view. It was nice and broad.
One of the main gray areas in ACL is the mechanism. No one still knows the exact way. So the biomechanical analysis, especially of the Michael Owen's video, was perfect. So superimposing his skeleton on top makes it look quite neat, and it's quite good. So now I'm actually thinking of speaking to the local clubs and see if I can run a program where we can start preventive measures for ACL, especially in young athletes.
From this Congress especially was the combination of surgical versus non-surgical epidemiology and treatment. As surgeons, we tend to just a lot of times go on our intuition, and we don't have a lot of the facts to back it up, and this really gave us a lot more of the facts to back up what we're doing and what we should change.
So there's been a lot of studies that were presented on using exercise and specific exercise training techniques to prevent ACL injuries from occurring, and that was exciting to me to see that focus shifting away from surgery and rehabilitation to how do we prevent this from happening in the first place.
I think ligament injuries are linked to OA via that kind of macro effect, but I think there's also potentially a mechanism of etiology by way of micro instability. So even patients who are asymptomatic in the absence of stabilizing ligaments have altered kinematics, almost by definition, and those altered kinematics can result in indiscernible increased micro shear, which may also predispose to future degenerative disease.
I think there is fairly good evidence that there is a big connection between ligament injuries and OA. There is a well-established scientific relation, but we don't know how big it is. It ranges from somewhere around 10 to 20% up to 50% that would get OA after a ligament injury, which is a lot, considering also that they are young getting their injuries. So 10 to 15 years might just be that you're 35 when you get OA, which is of course a disaster.
I think the unloading concept is a very fantastic concept, especially for the place where I come from. I'm also excited about the PCL rebound brace. I've used it recently on a patient, and I was very happy to learn that it is the brace with the label DNA. I mean, it's a healing brace, so I'm hoping that my patient does very well with that. So I'm overall very excited to see the products that are there to offer and the concepts presented at the Congress.